Today, we're going to break down a condition that affects millions of people, a lot of whom don't even know they have it. It's called anemia. We're going to get into what it is, why it happens, and what you can actually do about it. So let's dive right in. So let me ask you this. Have you ever felt just bone tired? I mean, that deep exhaustion where even a full night's sleep doesn't touch the sides. You just feel weak, maybe a little out of it, and you have no idea why. Yeah, if that sounds even a little bit familiar, I promise you, you are definitely not alone in feeling that way. In fact, we're talking about roughly 3 million Americans. That's how many people are affected by anemia, which makes it one of the most common blood conditions out there. Okay, so what is really going on inside your body when you feel this way? Let's pull back the curtain and take a look at the mechanics of it all. At its most basic level, anemia is a problem with your body's oxygen delivery service. See, all of your organs and tissues need a constant supply of oxygen to do their jobs. And your red blood cells, they're the ones in charge of carrying it. When you don't have enough of them or they're not quite up to snuff, the whole system just slows down. And you can really feel that slowdown in some pretty common ways. The number one sign is that fatigue we talked about, but it can also show up as feeling short of breath, getting dizzy, or having hands and feet that are just always cold. What's tricky is that some people might not have any symptoms at all, which is why it so often gets picked up during just a routine checkup. To really get a handle on this, let's think about it a little differently. I want you to imagine your entire circulatory system is like a massive nationwide delivery service. So in healthy blood, you've got this huge fleet of delivery trucks. Those are your red blood cells, zipping around, picking up oxygen from the lungs and dropping it off exactly where it needs to go. But with anemia, it's like you've got a major truck shortage. Suddenly, deliveries start getting missed, and parts of your body are left waiting for the fuel they need to work properly. And you know what? This analogy is the perfect way to understand what your doctor is actually looking at in your blood test results. Your red blood cells are the trucks. Hemoglobin, well, that's the precious cargo. It's the protein that actually holds on to the oxygen. And hematocrit, that's just a way of measuring what percentage of your blood is made up of these trucks. When those numbers are low, it's a dead giveaway that you've got a delivery problem. So, why does this delivery service fail in the first place? What's causing the truck shortage? Well, it almost always boils down to one of 3 main problems. Let's break them down. First, you could have a production problem. The factory, which is your bone marrow, just isn't making enough trucks. Second, it could be a loss problem. You're losing trucks faster than the factory can build them, usually from some kind of bleeding. And third, you might have a destruction problem, where something is causing the trucks to break down and get taken off the road way too early. Now, of course, certain things can put you at a higher risk for one of these issues. Your diet is a big one. Your body needs raw materials like iron and vitamin B12 to build those red blood cells. Pregnancy puts a huge demand on the system, and other things like chronic health conditions or even just your family history can play a really big part too. But here is the really good news. This is a solvable problem. Getting your body's delivery service back up to speed starts with a clear diagnosis and a plan that's tailored to you. And the process itself is not intimidating at all. It just starts with a conversation with your doctor, talking about your symptoms, your health history, your lifestyle. From there, it's usually just a simple blood test that tells the real story. That test is called a complete blood count, or a CBC. It's the go-to tool for diagnosing anemia because it directly measures your hemoglobin and hematocrit, the cargo and the trucks we talked about. If those levels are lower than they should be, you've got anemia. The next question is just, why? And this part is absolutely crucial. The treatment has to match the cause. For example, if you're low on iron, then iron supplements are probably the answer. If it's a vitamin issue, you'll get supplements for that. But if the anemia is happening because of another chronic illness, the real fix is to treat that underlying condition. It's all about finding the root of the problem. So once you have that diagnosis and a treatment plan, you really become the most important player on your own health team. There is so much you can do every single day to manage your condition and start feeling better. Let's start with diet, especially for iron deficiency. Here's a great little tip. Try to eat your iron-rich foods with something that has vitamin C, like oranges or bell peppers. It actually supercharges your body's ability to absorb the iron. But on the flip side, try not to drink coffee or tea with your meals because they can block that absorption. Oh, and cooking in a cast iron pan, it can actually give you a tiny little iron boost. Taking your medication correctly is just as key. For iron supplements to work their best, you really want to take them on an empty stomach, if you can tolerate it. And definitely don't take them with milk or antacids. They get in the way. But the biggest rule of all,
Never, ever stop taking your medication just because you start to feel better. You have to talk to your doctor first.
And finally, this is so important, knowing when to get help. There's a huge difference between an emergency and something that's just important. If you're having severe chest pain, you're fainting, or you really can't breathe, that's a 911 call, no question. But other things, like your symptoms slowly getting worse or you're having bad side effects from your meds, that's a reason to call your doctor. Knowing the difference is how you stay safe.
And there you have it. If there's one thing to take away from all this, it's that feeling exhausted all the time isn't something you just have to put up with. It can be a really clear signal from your body that something's off. And that brings us to one last question. What's one small step you could take starting today to listen a little more closely to what your body might be trying to tell you?